Good afternoon, Dr. Raja. We are very honored to have you here to be part of our few minutes where we can talk with you, and also for you being able to attend the polls 2025 1Cell.AI conference. Dr. Raja, as everybody knows, is probably the best oncologist, is in fact the best oncologist in India. Dr. Raja is the head of medical oncology at the Apollo Cancer Center in Chennai. Is that correct?
Yeah, good afternoon, and thank you for calling me, and thank you for this dialogue.
Of course. Thank you so much for taking the time. I think first, Dr. Raja, my first question to you would be just to understand a little bit about your journey to how you decided to do medicine and kind of go become a doc physician and also oncologist. It'll be great for us to, and for the audience to understand how that kind of evolved.
Um, choosing to go into medicine is some kind of providence, I would say, and some plan, and sometimes it happens. So that's my honest answer. But having moved into medicine, I think very early on, I decided that oncology is going to be a very, very important field in the future. And I think I decided to do oncology almost very early on, I can say, because I thought that it's one of the fastest changing science. And I could also understand that from that time period, that treatment is going to change. Treatments options are going to evolve, and they are going to be more and more driven by what's happening or what's happening at the cellular level, or even going deeper into that at the level of the DNA, RNA, or so on and so forth. So that aspect of a cell or a live cell as an individual who is trying to fight back and then evolve and change and try to take over the individual, that fascinated. So I went into oncology from that thought process.
That sounds fantastic. And of course, we all know, India knows, you're the best oncologist. I don't think there's anybody who can beat all of the work that you've done and also the number of patients you've treated. So that kind of brings me to your next question. And I'm sure it's probably quite difficult for you to choose any one, but is there any one case or where you felt that you have used classical treatment methodologies to be able to treat the patient? Because then obviously I'm going to talk to you after that about evolution with technology. So first is, what did you, any one case comes to mind to you?
As everyone was aware of oncology, but then something happened around the year 2000, I would say. Just before 2000, malignancies were treated with um, from medical point of view, surgery, radiation. Post that, malignancies were treated with antineoplastic drugs, which were basically targeting, at some point the multiplication process, as you know. But then probably a couple of things changed this whole paradigm. Chronic myeloid leukemia and the identification of BCR-ABL gene happened. And then people realized that, you can treat it in a very intelligent way. But it was thought that it was a pure accident. Somebody found something and it happened in chronic myeloid leukemia, and it will only be chronic myeloid leukemia. But in the year 2000, the lung cancer, which is one of the commonest cancers, suddenly there was a understanding that EGFR pathway is important, and you can target that. And the first EGFR targeted drug, gefitinib, was studied, and from 2000 onwards. And then by 2002, 2003, you hear about it and you get the publications and all that. So that was the first time you see that the tumors can be treated in a targeted manner, precisely targeting what is wrong in them, sparing everything else. Around the same time, we had a patient. I still remember a lady, advanced lung cancer, who was treated with conventional treatment option, one line response, but again progresses. By 2003, we hear the first publications of Gefitinib, and around the same time, this lady progresses on lung cancer. Late 2003, it again happened. We could somehow reach out to the in US, NIH, or we could get the Gefitinib on compassionate basis, and I had the opportunity to use it on our patient in 2003, and we see dramatic response. That convinced me that this is going to be the way one has to move from a broad-based anti-neoplastic chemotherapeutic drugs. There's going to be a totally new way to look at things, and that was the starting point. And after that, I think it was like almost like a floodgates open. Every tumor, every malignancies, now they are working on what can be targeted. Not a single target anymore. It's going to be multiple target. How do we understand the pathways? And we try to control the not only the individual targets, but broader pathways. And so the science has rapidly grown from there.
That's fantastic to know. And of course, hopefully, when you implement such changes, the entire India and all the medical oncologists in India will follow because you have already set that trend and you've been the leader in that. So, my next question would be mostly to do with technological advancements. There have been so many technological advancements. Prior, people would treat patients, just chemotherapy became the standard of care. And whether neoadjuvant therapy, depending on whether it was breast cancer or the cancer, there's certain cancers, neoadjuvant therapy is possible or not, or after surgery, adjuvant therapy. How has technology changed your way of thinking and how you have modified your treatment decisions with your patients? Technology like 1Cell.ai, but or other technologies, how has it changed it, and what is your vision for the future?
Basically, over the past few years, the the pathology has tremendously improved. From regular pathology, now it is inevitable that you have molecular pathology. When you talk, of course, imaging science have also grown in a explosive manner. So you can now look at tumor cells or tumor aggregates present, spots present. I mean, anywhere, all that has explosively grown. But talking about the pathology and molecular pathology, now, as we just said, DNA sequencing has become an absolute necessity in almost all malignancies. Um, Beyond that, now people have moved on to do RNA sequencing. That has already become a common terminology, I would say. Then people have moved on to RNA sequencing, and now we are seriously looking at how we can capture those single cell, circulating single cell. They call it as circulating tumor cells, and then try to derive all the information by breaking down that single cell, looking at the level of RNAs or looking at the proteins there. And so this has now evolved into um, RNA sequencing, and then now we talk about proteomics, and fashionably called as multiomics. And the dream is that if we can do a simple blood test and if we can pick up that tumor cell and then try to analyze that tumor cell, that will completely change the paradigm of how diagnosis is going to come. That's where these technologies have come into a big play. Um, Fortunately, many companies are working on this. OneCell, I would say, is doing a great job in bringing many of this technology to India. and they are probably they are probably now one of the most recognized group in in uh, in liquid biopsies, and now they are increasingly being recognized for their circulating tumor cell technology. And I believe that the CTC technology that the one cell is bringing is probably even ahead of some of the Western counterparts. So there will be a day very soon. I'm sure there will be collaborations from both the Western world and institutions and our companies like OneCell, that the diagnosis of a cancer can be done just at the draw of a blood. Not only that, that could be the first step, but actually, as a clinician, once you start treating, every week, every month, if I want to monitor what's happening and what changes are happening, this is like longitudinally sampling the evolution of the cancer. That's again going to bring in another revolution, that it's not only enough to know the disease at the beginning, at the upfront, but you can track the disease evolution and behavior as it goes on. So I think there's going to be more and more interesting and more exciting, but it's going to open up a lot of options to treat the patient, and that's going to change the cancer management. I have no doubts about that.
That's awesome to hear. Fantastic. And especially coming from you, I think we're very honored to have you with us and you being an advocate for us also. But more importantly, just your vision for the future is what's very important. So thank you so much, Dr. Raja. If
Thank you
there's
so
any
much.
other last words or any other visions that you have which we have not kind of yet touched upon and at Pansel, I mean, if you would like to share anything else, we're happy to learn.
Some companies, this we have seen in history, um, develop great technologies. You can respectfully quote, iconic companies like Apple or let's say Google, and but then the next challenge is how to reach it to a broader. I mean, how to reach it to the entire population, how to reach it to almost everybody who is in need. That that brings in political will, social structures, economic savviness, and that needs a lot of partnership from the authorities to the market to finally the public. I think if all these things happen, we may very soon hear that cancer is one another disease, and people are not anymore frightened about cancer, and there is ways to treat it, and people will become better, live longer, and the quality of life will be maintained. That's going to be our dream.
Absolutely, that is. And thank you so much for sharing your insights today. We will continue to want to work with you and continue to learn more from you. And we just hope that your wisdom and your insights and your new application of technologies will help all the other medical oncologists in India and the hospitals in India. So thank you so much. It's a real pleasure and an honor to be able to interview you. Thank
Thank
you.
you so much.
Thank you.